We are talking about the neck.
And the reason we love to talk about these things is because, and I'll tell you, for me, it's hit home when I speak to a patient that, for example, last week in Sarasota, okay, who's like, I've been listening to your podcast. I listened to everything about a mommy makeover. You don't even have to tell me anything because I learned everything from your podcast. So you really make us feel great that we're giving you guys information and it's helping you, and then it's actually helping you on your surgical journey. So today we really want to help you out on what are the things you can do to improve the appearance of your neck, because it's one of the areas on our face that really people come in and they're like, everything else looks really good, but what can I do with this? Or it's too full, or now I'm getting gels. And Dr. Layke's a master here, and I'm going to kind of have him run with it, but I'm going to start with, and I'm going to bring him into his world of good, better, and best. And I do think that age matters, skin quality matters, health status matters, comorbidities matter. But we're going to start out as to you're healthy, you're relatively in good shape, and you're not too old to have surgery. So when we do talk about those things, you have to be a decent candidate. But we're going to start out with non-surgical treatments.
Yeah, look, let me take a step back. I mean, when you look at good, better, and best, the idea is there are really, I would say, 3 main problems with the aging neck, right? And it doesn't always have to be aging, but we talk about the skin, we talk about fat, we talk about muscle, and that's why the neck is so complex. You know, it's interesting when I'm doing a consultation on the face, I always say, you know, I divide the face into thirds: eyes up, eyes to mouth, mouth all the way down to the clavicles. And it's such a large region and it's attached to the face. You turn, nod, you know, you're constantly moving it. It's thinner skin. And so it's I would say it's the second most common way you can tell someone's age. The first is obviously when you look at the eyes.
Absolutely.
The whole periorbital region. But when you look at the neck, that's kind of the next giveaway of a person's age. So we're going to run you through some tips and tricks we're going to start in that good category. Not everybody wants to jump right into surgery. So that's why I always love this option, because we will start definitely with skincare and what you should be using, right? And, you know, we obviously have a skincare line, Beverly Hills MD. We love some of our products because we see all of the different lines out there. We see what works and what doesn't, what actives, and, you know, it becomes easy for us because we say, oh my gosh, we've got 90% of people saying, I love this product. You look at the active ingredient and then you can see why.
And the line is very much catered to what we've seen over the last 15 years in private practice. And the, complaints that people have. And one of the biggest complaints has been, my neck is crepey, my neck is sagging. How can you improve the appearance of the skin? Because obviously no skincare, no cream is going to be able to produce a neck lift. But for some people, some of the products that we've come up with, and other brands as well, can really help that appearance in the short term.
Yeah. What I would start off, so, these obviously are ones that can be purchased. And again, it doesn't have to be our line, but it's something like this. And this is where we'll have, let's start first with, we'll eliminate just a regular moisturizer because I think that should be part of everyone's regimen, right? But the neck is different. It has generally thinner, drier skin. And so you need to use something that's just a little different. And I love, if you're doing a quick fix, you can use our Advanced Rapid Neck Lift Serum. But if you're doing something a little more long-term, I would use, our Lift and Firm cream. And the active ingredients in these, again, we're using ingredients that will not only help hydrate the skin, but the active ingredients in it alone use several different ingredients. Another product that I love actually is a Tighten and Brighten oil because the L22 product in there that kind of restores the normal oil balance of a 22-year-old. And you see that as the skin slowly loses its elasticity. And after age 18, you lose 1% per year of collagen. I mean, the idea is pretty soon that adds up. So I would start off with, a good moisturizer. We also talk about what your skin needs as a cofactor, which is vitamin C. And I love our dark spot corrector because we're high concentrated vitamin C, or our product, which really is a vitamin C booster. And the idea is, again, vitamin C is a cofactor for formulating or making collagen. And so I think it also helps brighten the skin. The neck isn't as... When we think of sun damage, it's not the first place that you think. But as you approach the chest, that junction, people will have cancers right around there just because you end up burning that. Face blocks it. So the other thing that I think everybody forgets about, we always put a retinol on the face because we want to increase that cellular turnover. But what about putting it on the neck?
And going all the way down to the décolleté.
That's right. That's right.
Very important.
And so now the one difference is you may only be able to put the retinol on every other day or every third day because, again, it's thinner, more delicate skin, and you may not be able to tolerate putting a retinol on every single night.
May get too dry, may get too red. So just, that's why we really kind of never put retinol around our eyes. Never put them on our eyelid skin because it's so thin. It can be very big irritant and even thin it even more, some people say. Yeah. So those are the ways we can treat the skin, but there are other ways now that aren't topical solutions that, obviously we offer in the office, but most practitioners offer as well to tighten the neck skin without surgery. And what do we do what do we use for those?
Yeah, look, I think if we're looking at kind of resurfacing the skin a little bit, you have to look, if we go on from lighter chemical peels, but I find that for neck skin, what you really need is to stimulate collagen in that thin neck skin, right? And so to me, using microneedling to our advantage is such a key component of a skincare process because, when we use these tiny pens with these tiny needles that penetrate the skin, and it has to hit reticular dermis. It can't just be, the ones they sell. I love the ones they sell off Amazon and things like that. Some of them just don't get deep enough. No. And if they do get deep enough, trust me, you're going to
scar yourself.
Yeah. So the idea is you want to do this in a controlled setting where the needle of the pen can be controlled as far as its depth, and you use microneedling of the skin. I think one of the best treatments for the neck is microneedling with radiofrequency, which is the electrical form of heat. So imagine it forces collagen stimulation. The heat itself tends to tighten the skin. And so, we have the Morpheus. There are other brands. Exion is another great one that combines radiofrequency and ultrasound.
And you can even drive some exosomes in with that too.
Definitely.
Or PRP, or even what else we've been doing is doing the Morpheus or Exion and then injecting with SkinVive or with Profilo, which is a skin hydrator as well to plump the skin. There's so many cool ways to do this. And again, now we're talking about minimal skin laxity. Someone that's super young just wants to tighten it just a little bit. We're still not getting into the neck lift phase yet.
Yeah. The other thing to think about is when we think of neck skin is to look at the tech neck, right? Yeah. The tech neck is ultimately those horizontal lines that form because you're constantly looking down at your phones, constantly looking down at your computers, your Zoom calls, and you develop these creases or rhytids of the neck. It used to be that people would try to fill them in, but that kind of looks odd too. It has to be the perfect amount of hyaluronic acid. Otherwise, you're going to raise that line.
People are using dilute radius, which is causing a lot of issues. Please don't do that.
Avoid at all costs. The other thing that we talk about is using lasers to our advantage. When we use lasers like fractionated CO2 laser, you can even use the wavelength, I think is 1947. That's our clear and brilliant.
Sure.
But a more intense laser like the fractionated CO2 can also cause that thermal injury that tightens the skin and reduce the appearance of those lines.
And really helps with the fine lines of the neck. Really great for the décolleté. Tightens the décolleté, sometimes even takes some of the pigmentation away as well. But now, what if you had a young man or woman came in and just had a very full neck? Now we're not talking about skin laxity. We're not talking about lines. We're not talking about any of that. It's just a full neck.
Yep.
Now, what are the good, better, best options for that? And again, we'll wait for surgery and talk about surgery later.
Yeah, listen, the easiest one we always talk about is liposculpture. And so through tiny incision, under the chin and behind the ears, sometimes we can triangulate and really carve out a jawline, right?
And this can be done awake too. This is like this is actually a very simple procedure that can be done awake or sleep. It's probably one of the few areas of liposuction that I will do awake because it's not a significant amount of volume.
Liposuction can, sometimes people have genetic pockets. The non-invasive portion of this would be that you either use cool sculpting,
okay,
which is cryolipolysis, and it's in 35 minutes. Whatever the applicator can fit, it'll reduce up to 30% of that fat, which is
cryolipolysis, big word for just freezing fat, okay? Yep. By freezing fat and taking it to a certain temperature, we know that fat cells will go into what's called a programmed cell death, and they will go away. So, and those fat cells that are there, there's only a certain number. So once you get rid of them, that area gets smaller.
Yep.
Very, very effective way to do it. There's been, some bad press by some celebrities about cool sculpting, but it's, who knows how warranted it was.
Yeah, I think it's still great technology. It's absolute genius technology.
You can do it during your lunch break and you're out, minimal bruising, minimal swelling, and it really does give good results.
Yeah, 35 minutes, 30 up to 30% of that area is gone, right? And so those are for all the people who have that genetic pocket that's just driving you crazy.
Now, what if they didn't want to do the cool sculpting? What else can they do?
So there is an injectable called Kybella, and essentially I think it's sodium hypochlorite, which ultimately will dissolve some of the fat. And, I think it's a great option for those. Let's say the cool sculpting is really for the area we call the submentum, which is under the chin. But if you have a full jawline that goes all the way along the angle of the jaw, then you may want to consider using Kybella or even as an adjunct to cool sculpting, because you can, use this injectable all the way along the jawline, whereas cool sculpting is really a set applicator that goes in that submentum.
And most of these things that we talk about, just so you know, for the listeners and viewers, we've done these things. We actually can tell you that they've worked, or else we would never recommend them, just so you know. So, we've actually personally injected the Kybella. We've done, not to ourselves, maybe I should, but we've done these things. So we know the proofs in the pudding, and that's why we recommend them to you.
Yeah, those are great options, again, to non-surgically reduce some volume, right? But then we get into the liposculpture. And that I kind of discussed. It's easier to carve out a jawline. It's easier to, really eliminate as much of that fat as you can. You have to understand with the injectables like Kybella or the cool sculpting, you have to repeat those multiple times because it'll only take 30% of what's in the applicator. And same thing with Kybella. It can't be so strong that it, strips your nerves and everything else. So obviously you'll probably have to do more than one session.
What's so great about this is Dr. Layke has all of this in his armamentarium. So when somebody comes to see him, and some people in all reality are only a good candidate for a deep neck lift. And unfortunately, some practitioners don't know or aren't trained in that, so they'll throw everything else at you, meaning Kybella and cool sculpting and even liposuction, and still have a very mediocre result for a very full neck.
Sure.
Now, what's the next step in somebody who has a really full neck? And then we'll talk about, rejuvenation of the neck for somebody that's older, for platysmal bands and things like that.
Yeah, look, I think there's still one more step in between there, and that is when we start using liposuction with radiofrequency.
Okay.
And so the idea behind that is going to be that now, because it's minimally invasive, but it's still invasive, what you would do is not only do you perform liposuction, but you heat up the skin from the inside. So someone with a very full neck that has, mild excess of skin, I think it's a better treatment than just liposuction alone, because what you don't want to do is leave extra skin, because that ages.
And it can't be significant skin. Just a little bit of skin laxity. It works beautifully. And the
mild.
people that kind of put it down and say it doesn't work. Well, it doesn't work on the wrong patient. But if you pick the right candidate, it really works beautifully. And it's a great way of avoiding to have a neck lift if you don't need to.
Yeah, that's definitely agreed. So I think that's a great option. You know, again, you have to have mild neck skin laxity with a full neck, and that way the liposuction removes it cores out a lot of the fat, and then you tighten up the skin ever so slightly just to try to give you more of an angle to the jaw.
And the beauty of that procedure is it continues to work for a while. So it looks good, looks better 2 months later, works better 5 months later, 6 months to a year, you get your final result.
Yep. And then beyond that, when we talk about, you're saying going into more of an aging neck, when we start seeing those bands, let's say you're a younger individual, you're thin. We all have these muscles in our neck. They're called platysma. And some of them split. You know, there are different variations of how those muscles are set in your neck, right? And if held up by certain ligaments and, you know, nice taut skin when we're younger. But as you age and you lose that elasticity and collagen, now we can start seeing the leading edge of those bands, which are along the anterior front part of the neck. And so one of the easiest things to do is to place a neurotoxin like Botox or Jeuveau or something like that, because, you know, you have to imagine if the platysma muscles are attached from the jawline, the angle of the mandible, all the way down to the clavicle. And if it contracts and there's some laxity, you're going to see that muscle bridge forward and really become visible. So if you want to eliminate the visible platysmal bands, then you go ahead and put a little bit of Botox in
And
there.
the key to that is start early. If you see bands, put them in right away, because what it does, after a while, our skin has memory. And what happens is once these platysmal bands are continually contracting, just like if our frontalis muscle continue to contract, those bands become more of a permanent fixture. But if you prevent them from contracting, the chance of having that form and 20 years later really be evident are much less.
Now,
let's talk about a neck lift.
Yeah, when we get into the next level. So obviously, good was the non-invasives, better is the minimally invasives, best is going to be surgical. And so everybody asks me to say, well, what's the difference? And so I try to give a percentage. Let's say the good category improves your neck by 15%. It's still significant, right? And maybe even to 20%. If you start doing in the better category, let's say it's 20 to 30%. Now it's still significant. But surgery is 80%. That's just the way it is. And so sometimes using a combination of some of those treatments can get you a little higher in the middle category. But really, there's no comparison to surgery. It's just the gold standard. And so there are multiple different ways of performing a neck lift. One is, we call it an anterior neck lift. And that's really for someone who's got a very full neck. They're younger. It's a genetic trait. And you know that liposuction isn't going to help them. So through an incision that's done under the chin, we can essentially core out not only fat above the muscle, so that normally where liposuction would work, but also there's fat below the muscle. And no amount of liposuction or any treatment that we do is going to affect that. And so that's why many people who aren't diagnosed properly will still have a mediocre result, because there is, we have to change the configuration of the neck. Some people have very short neck muscles. So a retrusive chin, smaller chin, shorter platysma, and ultimately what we need to do is not only create an angle, a more youthful looking neck, we have to force it by removing that fat that's under the muscle, but we also have to cut some of the muscle, sometimes to window shade and allow that neck contour, that lateral neck contour, to look like it's a 90-degree angle. And the only way you can do that is through surgery.
And for most of the time, how often, and this is something that I know is so common for you, how often do you get somebody that comes in and says, oh, my neck's really bothering me, but they really need a face and neck?
Well, I didn't make it past the front, the front of the anterior approach. And so that brings me into the next approach, because the incisions can be very similar. And so what we do is we make incisions that are just behind the earlobe, behind the ear, and back into the hair. that's a combination of an anterior approach and removing some of that excess skin. So that's someone who's got moderate excess. Maybe they have a little bit of fullness in there too. That can easily be corrected. But now we really have to remove that extra skin. It's got to go somewhere. So what we do is we kind of rotate that excess skin towards the back. You trim it, and all of the incisions themselves are hidden. But sometimes, and this is a great test for everybody out there. For the viewers, if you pull the neck backwards and you make your front neck nice and smooth, but it pleats right in front of the ear, you may need a more advanced neck lift or even move into a lower face, because what you don't want to do is rotate all that skin and still have some excess, because what will stand out are the jowls. And that's, again, that's a neck lift gone awry, because it really isn't. Sometimes people need to treat the lower face as well.
You don't want your neck to look super rejuvenated and your lower face not to, because it doesn't kind of flow, right?
Yeah, even if there's a tiny amount of jowl, it will be accentuated, because now it looks, the neck looks so much more youthful than that jawline. And so
absolutely.
Now, sometimes what you can do, and I do something called a deep neck, goes along with a deep plane, and that's where, as we age, sometimes you go under the muscle, you reconfigure the structure. Sometimes the accessory, we'll say secondary salivary glands, called the submandibular glands, sometimes those become larger as we age, and they tend to fall, and so they leave that little bulge that's midway between the chin and the angle of the jaw, right underneath the angle, right underneath the border of the mandible. And sometimes we have to remove a portion of that just to give you that nice clean jawline. And that's why, but again, for those of you who want to do that quick test, you take your hands on both sides, on the sides of your neck, tighten your neck as much as you want. And if there's too much pleating in front of the ear, you likely will need an incision in front of the ear. There are different degrees of that, and so sometimes we can get away without it. But, if there's a ton of excess skin, you have to imagine, usually the way we look at it in the face is, if we're trying to target our particular level, meaning neck, border of the jaw, anything like that, you'll kind of have to treat one level above it in order for you to get the most natural appearance. There are guys who will try getting away with it, and it just won't have a natural appearance, and so you'll end up aging a little differently. It just won't look right. And so that's why you do that quick test. You'll have a pretty good idea of whether or not you need a lower facelift with it.
Asking for a friend questions, even though I need it myself.
Yeah.
So how long does a neck lift last? Hold on. I'm going to ask you 3 questions. You can answer them all together. How long is the recovery, and how bad is the recovery? And what's the worst thing that can happen?
Sure. How long does a neck lift last? Look, we always say 8 to 10 years. A good neck can last longer depending on what type of maintenance you do afterwards. But I always say the same thing. Let's say we take 8 to 10 years off the clock. Everybody ages at a different rate. And so that's more of a true answer.
Okay.
The neck lift recovery, look, you're in a wrap usually for anywhere from 5 to 7 days. So a compressive type of wrap. And then when we take those dressings off, we'll give you a Velcro wrap, or at least I will, just so you can wear that at night for the next few weeks, or when you're hanging out at home. You put that on just so it reduces some of the swelling. How bad is the recovery? Look, without being too graphic, I mean, a lot of those superficial nerves are stripped. And so most people say that it's relatively numb, and that can be numb for several weeks. Where people complain, I think, is if we have to leave drains. Those are placed behind the neck and the hairline. And, listen, anytime you have to carry a drain around, it's never a fun thing.
That's hanging off your head.
Yes. But ultimately, I think most people tolerate a neck lift pretty easily, and even facelift for that matter. Yeah, those are the same thing. And so now, as far as swelling, I would say to be event ready, I always say the same thing, even if I'm doing a facelift with the neck, it's 10 to 14 days where you don't really want to go out in public. Neck is probably less, just because it's not as visible and you can wear your hair down. And so, but to be event ready, I always say the same thing, 6 weeks to be event ready. And then final results, that can take 4 or 5 months, where that just last little residual bit of swelling can be annoying to you. Most people won't even notice it,
Right.
but that, that type of swelling can take 4 to 5 months.
Awesome. Listen, I've watched you do this. We've performed these surgeries together where I'm doing someone's breast or body and you're doing neck. And it's fascinating to see the results immediately on the table, because it's a game changer, and it really does turn back the clock. For the person who's got a really full neck, completely changes their appearance.
Yep.
I mean, I can tell you that it makes people look younger and more refreshed by just taking some of the fat out.
Yep.
But the actual neck lift, man, it restores people's appearance from 20 years ago. And it makes them feel younger and look younger. So I'm a big fan. And that's why I think our skincare line has so many different types of products that can help people that aren't in Beverly Hills or don't have a plastic surgeon or can't afford a plastic surgeon to really kind of rejuvenate their own neck at home. I stand by these products. If you don't like these, go find some other ones. I do think it's a great first step in trying to improve the appearance of your neck. So start that and go from there.
Yeah, listen, especially some of the skincare, when you've got proprietary blends like Titanil and things that will ultimately long-term help with the texture of your skin, I think it's definitely worth using. One thing to mention about a neck lift, you have to imagine, just because we've tightened the skin and made it look nice and smooth does not mean that we've added collagen into your skin. And so I always, for my neck lifts, starting at 6 to 8 weeks later, they automatically undergo a Morpheus procedure as well. And usually at the same time of the surgery, I will do a CO2 laser or something like that to help retexturize. But you have to imagine, we tighten that skin. I can tighten it as much as I want. But when you start losing that elasticity, you start getting a little bit of crepiness. It will redevelop it relatively soon, because you're not going to stop, bending your neck and turning your head and doing things, just to normal daily living. So that's why afterwards, I always recommend, every patient automatically undergoes a quick Morpheus treatment just to help retexturize.
But it's interesting. It's like that for most of our procedures. I tell people after a breast reduction, keep a bra on at all times, because gravity will take over. We have people do M-Sculpt after a tummy tuck. We have these adjuncts now to help to really maintain over time. Just because you've had surgery doesn't mean you could just go and just let it go. So, I think maintenance is key after an operation to keep yourself looking really good.
If you like this video, you're going to love this one. Deep neck is one of the most powerful tools that we have right now to really change someone who has a very full neck and face, to really give them a defined jawline. And some people will never have that, even with liposuction. And so, that's really where they become a candidate.